The human brain goes through incredible growth during gestational, and it continues on for the next couple of years. Children that were born premature have a bit of a disruption in that process, so they can benefit from early interventions.
It's important for the NICU to have a follow-up clinic because the babies are born very early, and in utero they're growing. We're continuing that developmentally. This is just the next step in their care, and the GAP clinic is an important part of that to make sure that their babies stay on track developmentally.
We know that premature infants and critically ill infants that have been in the NICU are at higher risk of having developmental delay. They can have difficulty achieving their motor milestones, they can have difficulties developing their cognitive abilities, they can have speech delays, they can have receptive language difficulties as well. But there are other things that we need to consider, like higher risk of a diagnosis of ADHD, higher risk of developing anxiety or depression later in life. We also know that premature infants have 70 times higher risk of having a diagnosis of cerebral palsy later in life.
We see babies starting at about 6 months of age, and then we'll see them every year afterwards, depending on how they do on their assessment and what we're concerned about.
It's fun for families to really see how well their child is doing, and then we provide families with written assessments so they can really understand how their child's doing at that moment.
You're just gonna come in and have fun with your baby. It's very comfortable for you. We don't want you to think of this as like stressful or a report card or anything like that. We would just want you to come in and be yourself and know that you are the expert. We're not the experts on your baby, you're the expert on your baby, and we're gonna be asking you questions and just getting a feel for how things run at home and how they do out in the community and what we might see.
When I see a baby that maybe could benefit from a few activities, maybe facilitate gross motor development, being a PT, I might provide just some exercises that the families can do at home. If the babies are young, sometimes that's just handling and positioning. And as they get older, it's just play activities that they can incorporate in their day.
So you might be wondering why your pediatrician can't do this in their regular appointment. Your pediatrician has a lot to fit into a well visit, but the most important reason is that our team of doctors and therapists have advanced specialized training in neurodevelopment. We're experts in finding problems early in premature and high-risk infants. Everything we recommend will be shared with you at the end of the visit and with your pediatrician.
What's really special about our NICU Follow-Up Clinic is that it is donor funded. So it does not cause any type of financial burden on the families.
We are so grateful to David and Patricia Nierenberg for supporting our program. And I also want to express gratitude to the PeaceHealth Southwest Foundation, the Children's Council for their support of the program. That kind of funding makes it so much easier for us to do our jobs and serve our babies and our families.
My experience with the GAP clinic, it was phenomenal. They helped us with finding physical therapy. We did occupational therapy, and honestly, it helped us with all the things that we didn't know were available and kind of helped us navigate that scary time. Honestly, I wish it was available for every mom.